Hello everyone, today we will be going over blood vessel anatomy. More specifically, we will be going over the anatomy of the veins. Veins are blood vessels that carry blood toward the heart. Most veins carry deoxygenated blood from the tissues back to the heart. Exceptions are the pulmonary and umbilical veins, both of which carry oxygenated blood to the heart. We will be going over pulmonary circulation later in the video.
Major veins of the systemic circulatory system. First, we have the superior vena cava, which empties into the right atrium, and it is formed where the two brachiocephalic veins merge. Next, we have the brachiocephalic veins, which receive blood from both the head and the arms. The internal jugular veins are from the head to the brachiocephalic vein. The subclavian veins are from the arms to the brachiocephalic vein. Next, we have the inferior vena cava, which is the widest blood vessel in the body, and it returns blood to the heart from areas inferior to diaphragm. Lastly, we have the common iliac vein, which joins at the L5 to form the distal end of the inferior vena cava. Next, we have the vessels of the head and neck. First, we have the external jugular vein, which merges from the subclavian. We have the occipital vein, the vertebral vein, the facial vein, which merges with internal jugular vein. Next, we have the anterior facial vein. It merges with postfacial vein, forming the actual facial vein, the posterior facial vein, and the superficial temporal vein, which feeds into the posterior facial vein. Next, we have the thoracic vessels. The internal thoracic vein merges with the brachiocephalic vein, the azygos vein, which merges with the superior vena cava posteriorly, hemiazygos vein, which is the left side of the vertebral column, the accessory hemiazygos vein, the ascending lumbar vein, which is on the right side of the vertebral column, and the subscapular vein, which merges with the axillary vein. We also have the long thoracic vein, which merges straight with the subclavian, and lastly, the axillary vein, which is formed when brachial vein merges with basilic vein.
We then go into the abdominal veins, starting with the renal vein, which is the vein that drains the kidney and connects the kidney to the inferior vena cava. They carry the blood that is filtered by the kidney. The gonodal vein drains directly into the inferior vena cava. Then we have the portal vein, which carries blood from the gastrointestinal tract, gallbladder, pancreas, and from the spleen to the liver. The superior mesenteric vein drains the small intestine, which becomes the hepatic portal vein. The inferior mesenteric vein drains the large intestine and merges with the splenic vein. The splenic vein drains blood from the spleen, the stomach, fundus, and part of the pancreas. It is part of the hepatic portal system and merges with the inferior mesenteric vein. Now going into the upper limb vessels, we start with the dorsal venous network of the hand. It is superficial anastomus of the posterior of the hand, and it gives rise to the veins such as the cephalic vein and the basilic vein. The basilic vein is a large superficial vein of the upper limb that helps drain parts of the hand and forearm. The cephalic vein is a superficial lateral vein in the arm, and it communicates with the basilic vein via the median cephalic vein at the elbow. The median antebrachial vein is a superficial vein of the anterior forearm that drains the superficial structures of the forearm and wrist between the basilic and the cephalic veins. The ulnar vein is deep and medial in the antebrachial region, along with the radial vein that is deep and lateral in the same region. The brachial vein, which is also deep, is the medial vein of the arm, meaning in the middle. And lastly, the axillary vein, which is formed when the brachial vein merges with the basilic vein in the armpit area. Going into the lower limb vessels, starting with the dorsal venous network of the foot, which drains blood from the foot. The peroneal vein drains the lateral part of the lower limbs. The anterior tibial vein empties into the popliteal vein. The posterior tibial vein drains the posterior part of the leg, being the calf and foot. The great saphenous vein is a large superficial vein of the leg, and it is actually the longest vein in the body, collateral with the fibular. The small saphenous vein is also superficial, but on the posterior part of the leg. The popliteal vein carries blood from the lower extremities into the thigh, and the femoral popliteal vein drains the deep structures of the thigh. The deep femoral vein is also a deep vein which is collateral with the femoral popliteal vein. And you then have the medial femoral circumflex vein along with the lateral femoral circumflex vein, and they both merge with the deep femoral vein. And now going into pulmonary circulation. And take note that in the pulmonary circulatory system, arteries are blue and veins are red. The pulmonary trunk carries deoxygenated blood out of the right ventricle. The pulmonary artery, which is a branch from the pulmonary trunk, goes toward the lungs. The lobar arteries branch from the pulmonary arteries inside of the lungs, and the lobar veins carry oxygenated blood into the lungs. The pulmonary veins then return the oxygenated blood to the heart.
That completes today's video. We hope that you enjoyed watching and learned more about the anatomy and physiology of the veins in the human body.